If you have post-traumatic stress disorder, or PTSD, getting everyday activities and errands done, like going to work or picking up your children, even weekend trips to the mall, can sometimes feel overwhelming and trigger memories of a traumatic event from your past. The symptoms of PTSD can affect every area of your life. You don't have to live like this. There is good news. Talk to your provider about what you're experiencing, because there are treatment options that can help. Evidence-based studies show that talk therapies work best, and there are also effective medications that might be right for you. Medication may be a good choice if you don't want to try talk therapy now, or if you can't fit weekly therapy appointments into your life. And some people find that taking certain medication for PTSD while they are in therapy makes the process easier. So, how do medications work? When you have PTSD, there are changes in your brain and in the way your body responds to stress. Basically, your brain cells aren't able to communicate as well as they should. So, medications that balance the levels of certain chemical signals have been shown to help. There are a number of medications that research has shown to work best for PTSD. You may have heard of antidepressants. Many people don't realize that they're not just for depression. A number of antidepressants are also effective for PTSD and anxiety. Some balance your body's serotonin, which regulates mood. They are called selective serotonin reuptake inhibitors, or SSRIs for short. The best tested and proven SSRIs for PTSD are sertraline, more commonly known as Zoloft, paroxetine or Paxil, and fluoxetine or Prozac. Other antidepressants that work on both the brain's serotonin and norepinephrine systems are also effective. They are called SNRIs. Venlafaxine, or Effexor, works best for PTSD. All four of these medications can improve your PTSD symptoms, making them less bothersome so that you can navigate your life more successfully. Antidepressants for PTSD usually take some time to work, so don't give up, and be sure to stick to the plan prescribed by your provider. Typically, it will take about 4 to 6 weeks before you feel the full benefits of your medication. One word of caution: we also need to talk about medications that should not be taken for PTSD. Chief among these are a class of medications known as benzodiazepines. They include medications that you may have heard about, such as alprazolam or Xanax, diazepam or Valium, clonazepam or Klonopin, and lorazepam or Ativan. Although sometimes they might be prescribed in a crisis situation for sleep or extreme anxiety, long-term, everyday use can cause problems such as addiction, memory problems, driving accidents, falls, or even a worsening of your PTSD symptoms. New medications are being tested to treat PTSD, so as a general rule, talk with your doctor to make sure you have the best medication for you and that you are headed in the right direction. The National Center for PTSD is also a useful resource to give you the tools to make the best treatment decision. Go to www.ptsd.va.gov to learn more about medication options and other PTSD treatments. No matter how long you've been living with PTSD, know that you can get better.